Good to see you again. Last time we talked about when your body is sending signals through symptoms. And today we're going to talk about when not to reach for antibiotics right away. You feel terrible, fever, sore throat, sinus pressure. You go to the doctor and ask, "Can I just get an antibiotic?" It's a common question. But here's the thing. Not all infections need antibiotics, and using them when you don't need them, that has real consequences. Let's start with the basics. Antibiotics kill bacteria. That's it. They do not work against viruses like the common cold, the flu, COVID-19, or most sore throats. So, if you have a runny nose, cough, or congestion that started suddenly, and you don't have high fever, facial swelling, or symptoms lasting more than 10 days, it's probably viral, and no antibiotic will help. In fact, taking one unnecessarily can actually make things worse. Here's why. Resistance. Every time antibiotics are used when they're not needed, bacteria learn to adapt. They evolve, and over time, we get drug-resistant infections that are much harder and sometimes impossible to treat. Side effects. Antibiotics can cause rashes, diarrhea, and serious allergic reactions. They can also wipe out the good bacteria in your gut, leaving you with new problems like yeast infections or C. difficile. False reassurance. Taking an antibiotic might make you feel like you're doing something, but if it's not the right treatment, it's just a placebo with risks. So when are antibiotics appropriate? Strep throat, confirmed by a test bacterial pneumonia, diagnosed with chest imaging and clinical signs. Urinary tract infections with symptoms and positive urine tests. Certain skin infections like cellulitis, and specific cases like ear infections or sinusitis that are persistent, severe, or worsening after several days. If your doctor says, "Let's wait and watch," that's not inaction. That's good medicine. Here's what I tell my patients. Trust isn't just about getting a prescription. It's about getting the right one at the right time for the right reason. Because the more wisely we use antibiotics now, the more powerfully they'll work when we truly need them.